Hi, this is Jen, your Medicare and retirement guide. Welcome back to the channel. And today we're continuing our series on my parent is aging, what do I do? Internet's most searched questions in regards to Medicare and healthcare coverage. And remember, if you like this kind of content, consider subscribing. Comment down below on what you would like to see next, and I'll go ahead and make sure to answer all of your questions. And with that, let's get started with the first question. So today we're going to be covering things in terms of coverage and cost concerns. So that's kind of going to be today's topic in terms of the questions I'll be answering. So the first one, how much will Medicare cost each month? So if you haven't already seen it, I have a video, Medicare 101, here on my channel. Is the very first video I ever made. So if you want the full deep dive version of it, go ahead and click on that video after you watch this one. But the quick and easy version, Part A, usually free if your parent has worked for 10 years, 40 credits, paid to Uncle Sam and the government, because that's what we paid into. So they get the Part A for free. Part B has a monthly premium depending on the tax bracket of your parent. So the minimum tax bracket starting point for every American in 2025 is $185 a month, and it's just adjusted from there on up according to the tax bracket your parent falls under. Medicare Part C, now that depends on the state, county, zip code you are in, because depending on the zip code of your parent or where you live, they will have different plan options, and depending on the plan option they choose, they may end up with an additional monthly premium for that Medicare Advantage plan, or it could come at a $0 cost. Same thing happens with Part D. Now, if your parent signs up for a Part C plan, then they don't have to worry about Medicare Part D because that is already included in the Medicare Part C plan. But if they stay on traditional Medicare A and B only, then they will need to go ahead and purchase a monthly plan for their prescription drugs. Again, will vary depending on how many medications they take, the formulary, if it covers all of their medications, where in the formulary or the tier system their medications fall under. All of that has to be taken into consideration so that they can choose the correct Part D plan for them that will give them the most coverage and have them pay a little less, save a little coin. So the second question here, will they have to pay out of pocket for hospital stays or doctor's visits? Yes, unless they have, again, a Part C plan where they only have to worry about co-pays and how much they will be responsible for paying for their days 1 through 5, days 1 through 6, days 1 through 7, if they land in the hospital, or if they have a Medicare supplement plan. So they stay on traditional Medicare, the supplement plan will pick up the bill of what traditional Medicare will not pay for. So just remember, Part A does have a deductible. Now in 2025, it's around $1,700 if they end up in the hospital that they will be responsible for paying for. And then the Part B portion does have a deductible and a 20% co-insurance cost. So they will be responsible for paying those fees unless they have signed themselves up to Medicare Advantage or a Medicare supplement plan. Now, what does Medicare actually cover and what doesn't it cover? Excellent, excellent question. So what Medicare actually covers for is hospital care, doctor's visits, preventative services, rehab, and labs. What it does not cover is long-term care, dental, vision, hearing, or cosmetic surgery. Now, with the last portion of cosmetic surgery, if they have a certain diagnosis where they can go ahead and justify the cosmetic surgery, and I'm going to use for example here, ladies, if you have a history of breast cancer in your family, you can go ahead and ask your primary care doctor to test you to see if you are a carrier of one of those breast cancer genes. For example, I'll use myself as an example in this situation. My family does have a history of breast cancer and lady part cancers. And so at that point, I went and asked my PCP, hey, I want to make sure that I don't end up with a higher probability of getting breast cancer and having to go through chemo and radiation. That sounds awful. So they took a genetic test of my DNA, it turns out I was BRCA1 positive, and that automatically qualified me to go ahead and get double mastectomy done. And they asked, do you want breast implants? Do you want a flap? Do you want this? Do you want that? And yeah, the same thing happens with Medicare. If your parent has a family history of certain cancers, they can go ahead and ask their PCP, hey, I want to get genetically tested. And if they end up showing that they are most likely a carrier of a certain gene, they can go ahead and have certain procedures justified because they already have the predisposed genes to have that certain chronic illness. So there's ways to get around that. So next question, how do I find out if their medications are covered under their Part D plan? The formulary. I cannot stress enough to go ahead and research and put down you can go to Medicare Plan Finder or Medicare.gov to go ahead and put in your prescription drugs, see where they fall in certain tiers under the formularies of each and every company that offers a prescription drug plan. You can also reach out to a trusted agent to go ahead and look that information up for you if it becomes a little daunting or if it's a little, stressful to go ahead and see, or if you want the most up-to-date information for your service area. So go ahead, make sure you just look that information up. You can also call the companies if you want to go a step further and physically call each of the companies to verify that the information online is correct. That is all up to you, and it's part of your rights. You're absolutely entitled to have those questions answered. Last question I have here, is long-term care like nursing home or home care covered by Medicare? Only short-term rehab, so up to 100 days, and it's covered under certain criteria. So your parent must meet a certain criteria to have long-term care services like that covered, and that's up to 100 days. Make sure you ask for your summary of benefits and your evidence of coverage if you know your parent is going to need those services after going into the hospital, having a certain surgery. You're probably working and your parent is going to need additional assistance that you may not be able to provide if you have a family, if you have a job, if you don't even live in the same city as your parent anymore. So make sure you ask your parent, did you see your evidence of coverage? What is in your summary of benefits? Well, how much is your insurance company going to cover? Know your contract, know your rights as a patient so that you can go ahead and make sure you pull it up and you can justify, hey, this is all covered. This is what I'm entitled to, and this is what I'm demanding. In addition to like custodial care, like bathing, dressing, etc., that is not covered. And usually those benefits are an extension of Medicaid. So depending on which state you live in, custodial care can be covered by Medicaid, but it will vary from state to state. So if you have a parent that does qualify for Medicaid, then please research and ask the Department of Public and Social Services in your state if they qualify for in-home supportive services and what those types of services are able to do for your parent in the event that they need that extra care for bathing, dressing, feeding themselves, etc. Other than that, those have been the most searched questions for coverage and cost concerns in regards to Medicare. If you like this type of information and you want a little bit more, go ahead and click on these videos. These are awesome videos to watch if you wanted to learn more about our healthcare system here. Other than that, when you're ready, you can click my link in the description below so that I can review your benefits. Other than that, keep watching and I'll see you in the next one. Bye-bye.